which can cause issues. Or maybe, like extend your legs all the way, just extend them all the way. You can look at his VMO definition right here on the insides of his knees, relax, and you can kind of tell if somebody has a problem with one of them. That'll lead to patellofemoral issues. You have tight hamstrings, don't you?
Probably right now.
Yeah, okay. So normally I look at a knee and I start with it and I just look to see how the kneecap moves. If they have patellofemoral stuff, I expect this to bother them a little bit, just sometimes just moving it from side to side, from front to back. I check out the quad tendon up here. I check out the patellar tendon down here, down to the tibial tubercle. On the lateral side, you come down here. You can find the IT band and the LCL. Sometimes it's hard to differentiate the two, which one's which. And then down here, the posterior the hamstrings on the lateral side coming down here to the fibular head. On the inside of the knee, I'll just raise it up so you can see. I check a few things. You can follow the joint line down all the way down to where the MCL is to see if it's sore there. And then also, that would be meniscal type stuff. Along here, feel that? There's a little band of tissue sometimes in a lot of people called a plica. And so they can get pain from that as well. As we have problems and this kneecap tries to track laterally, that plica can be tightened up and it rubs and gets irritated over the femoral condyle. And so those can be painful for people too. If it doesn't hurt him, do I say anything about it in my note? I don't. It's there. It's common. He has one, doesn't bother him. And then down through here, you can find the hamstrings medially and track them all the way up to this area right here, which is where the pes anserine is, okay? So people can get bursitis and stuff associated with them. A little bit further down, I didn't talk about the IT band. Comes down to a place right here called Gertie's tubercle, which is where it inserts. So people with IT band problems can have pain all the way down to here on the outside of their legs. So that's simple stuff. Flex it up as far as I can, just so you know what the range of motion is. And you can also check when you're doing this, just tracking of the kneecap. So his kneecap tracks pretty good. It's straight. When I get to the terminal portion, it's not going off to one side or another, like J tracking. And then I'm kind of swapping between the two knees so you guys can see what I'm doing. This here is what I do to get him at 30 degrees, okay, to get him relaxed. So he's not relaxed, and I'd make him lay his head down, because what happens, that tightens everything up when they do that. And a Lockman's is pretty simple. You hold him down here and just bring this up. And what I'm really looking for, I'm looking for my thumb and this tibia where it ends. He's nice, solid endpoint. It's not going anywhere. If it was positive, I'd expect it to keep coming at me further, okay? And that would be consistent with symptoms of an ACL tear. The other thing while we're here, this is if I bring his leg out, varus or valgus stress?
Valgus.
Valgus stress. I'm looking at what? The MCL, right? Varus stress is going the other way. Okay, so I'm checking out here for it. And so I'm looking at to see, is the joint going like this and opening way wide, where it's completely torn and gone, or is it causing pain because it has a little bit of irritation of those ligaments? From here, I go to 90 degrees. People will teach you to sit on the foot like this, tell your patients you're going to do that. Sometimes I'll just use this is kind of low. But if I'm on a higher bed, I'll use my elbow to kind of stabilize things down here to do it. But for this, I'm looking at this contour here. See how that is? It's nice and flat. Okay? And I'll put my fingers right here, and I'll pull, and it doesn't come. So it doesn't have a positive anterior drawer, and you can push to see if they have a positive posterior drawer. And again, if it starts way back here, it's going to come up like this, and you're going to think you have an anterior drawer. But you want to check to look to see where is it sitting. If it's sitting back ways, I have act like you're trying to kick me, to kind of lift your leg up, see? And if it was a positive sag sign, this would come up toward me as well. This PCL was out. You can also just bring them up like this, just to see if they sag. It's kind of sitting in a position where it's kind of sliding back like this a ways. Would make you think as well that the PCL is out. From there, put my hands right. See where they're at? They're right on the joint line, and that's the key to this. Because when I bring him up like this, what I'm looking for is I'm looking at the joint line, right where this finger, my middle finger is here, and right where my thumb is out here on the other side of his leg. That's where I'm looking. I'm not looking anywhere else. If I bring this up and it hurts up here, that's not what I'm looking for, and that's what fools a lot of people. So you want to go like this, and what you do is you bring the knee in the foot in like this, and bring it out a ways. And that's checking nothing but for medial. So you're checking nothing but for medial meniscus when you're doing that. Going the other way with it out, you're checking nothing but for lateral meniscus. And I'm looking for pain and snapping back along this posterior lateral aspect of the knee. That's the only place I'm looking, okay? Other things that tend to cause people problems with the patellofemoral stuff is we get them to relax. So he's not too bad as far as popliteal angle. And so that's just without him helping, and that's why I'm feeling the quad and the hamstrings, so he can't assist there. And he's probably, 20 degrees from being straight? That's not bad. That's pretty good. A lot of white guys are like down here, like this. Okay, and it explains why they have a lot of knee problems. So those people need to stretch a lot. So, and then go ahead and roll to your belly for a second. And then the other thing too is just looking at the quads. See how tight the quads are? You bring the knee up, he gets his heel all the way to his butt. Some people will be like up here, and that's how tight their quads are, and so that causes a lot of issues with belly to the knee. Thanks. That's most of the specialty tests that we talked about.